Hey, good afternoon, our audience. We have Kyle, who recently attended the Bike Fitness Coaching Bike Fit class. Kyle, I know you're busy, so hopefully this will be a quick but informative interview and review. We want to get into some things that come up all the time on bike fitting. So for the audience, what's your background, education, and occupation?
Yeah, so I'm a physical therapist. I got my doctorate in PT in 2021 in Utah, and I work as an outpatient physical therapist in South Jordan, so pretty close to Salt Lake, Utah.
So what's your interest in bike fitting? Because you ask quite a few questions when we first talked. And why did you take this class?
Yeah, so my interest, there's personal and also for my patients. Personal interest is that I want to be as fast as I can and put out as much power as I can on my own bike because I do triathlons and a slight amount of mountain biking. And then also for my patients to improve their function and their pain on their own bikes.
So you're going to integrate it. It sounds like you're going to integrate it to your PT studio.
Yep.
So it's one question comes up. It's kind of we didn't discuss this initially, but what would a lot of the PTs, or there's something that's called a medical bike fit. What would be your opinion of a regular bike fit versus a medical bike fit? Meaning that I'm assuming you would integrate a bike fit with some kind of a program for somebody that's injured something.
Yeah. So a regular bike fit versus in a medical bike fit, there'd be a plan of care in place developed with the patient as they're going through the fit. So it's not just fitting the bike to the patient, but also looking at the patient's deficits and impairments, whether that be imbalances from either leg or leg length, or also looking at muscle restrictions like calves, hamstrings, posterior chain, and also strength deficits.
Yeah, I think that's very important because as a bike fitter and a non-medical person, I know I'm not supposed to diagnose and treat. So I would, as a bike fitter, I would have a relationship with Kyle to send my client to a PT to get something fixed that it doesn't seem right, that isn't right, something that the bike fit can't fix or isn't fixing. This is where a PT like Kyle would come in that understands both sides of the equation. So, in general, what were your overall thoughts on the course, and what do you recommend it to other PTs?
I definitely recommend it to other PTs because in physical therapy, we look at all the impairments and not just like, for instance, we don't look at orthotics when we have foot pain, but we look at the whole chain up and down. I think that's something that the course really hit home with is that we're not changing the bike or changing the person to fix impairments. We are looking at the bike and changing what we can to improve our mechanics. So, like no shims and wedges, right? Or a limited amount. We're trying to be as best as we can with the mechanics of the person so it fits them best.
Yeah, I think in general, you're what he's basically saying is, as I understand it, is you're taking an asymmetrical machine, the person, and trying to fit it to a symmetrical machine, and
Yep.
that's where these little nuances come into play. So, I have a saying on an ill-fitting bike, which most bikes are, the body adapts and absorbs until it can't adapt and absorb anymore. And that's when the pain starts setting in. But the problem is by that time, there's already joint damage, mainly in the knees and hips. In the knees, it's going to be a braiding away of the articular cartilage, which is the Teflon coating, if you will, at the patella femoral head and the back side of the patella, and the hips as well. So you also have shear and compressive forces on the meniscus. The more pressure you put on the knees, the more at max flexion the knee is bent, the more you're digging into that meniscus, and you see that's the term I heard, the layman's term is a blown out meniscus. It's usually cracked or cratered, and that's when you have to go to the orthopedic surgeon and get repaired. So one thing we do key in on the bike fit class, and we get into pretty good detail. Again, I consider it the most important is the right size cranks. And what do they fix? They fix two things. I'm going to talk about the first one, and Kyle, I think, can talk about the second one. The first thing the right size cranks will fix is, and again, the right size crank is normally shorter. It's going to open up the knee and the hip joint angles at max flexion. So at max flexion at 12 o'clock is where the damage occurs, not at 6 o'clock. Opening up the joint angles is going to cause less compressive and shear forces. The other thing I hear is that leverage and the range where the muscles work best and most effectively. So opening up the angles, what does that do, Kyle, to how the muscles work and where they work most effectively? So maybe you can kind of give us two levels of explanation, one for the bike fit people, the shop owners, the racers, the non-medical, and then maybe a little bit more detailed into those that might be a personal trainer, I get yoga instructor, somebody that has a little bit more knowledge into that. So take it away, Kyle.
All right. So when we are working within mid-range of the muscle, so we're not fully extended and we're not fully contracted, then we're at our strongest point. So when we have a crank arm that is too long, we're going to be putting ourselves into too much flexion, and we're going to not get the max output in the muscle as we could. And the same thing with the crank arm that's too long at the 6 o'clock position, our muscles going to be over lengthened. So in the bike fitting session or in a coaching scenario, you don't want to be outside of your optimal ranges because you're going to be losing output, and it's going to take more time, which is milliseconds, but each time you turn over the crank arm is going to count, taking that time away from when you could be in the optimal range. So the more in-depth version of that would be if you look at a power athlete, if you're doing a squat, if you go past 90 degrees or parallel on a squat with a heavy weight, it's much harder to get back up. That's why, like in powerlifting, you only go down to 90 degrees. It's much more optimal to be within the mid-range in that scenario to get that power output. Same thing on the bike.
So a little more detail maybe about how the muscles actually work. What's going on behind the scenes?
The best known theory is a actin myosin control center. So we have calcium in the sarcoplasma that goes into the muscle fiber, and those muscle fibers, or the actin and myosin, they make cross bridges. And so if we are extended too far, then our cross bridges are not engaged. And if we are too far flexed, we have cross bridges that have maximally engaged. So our most optimal power position is in the mid-range when we have just enough myosin and actin cross bridges performed or made, so that when we contract the muscle at that point, we can either go into extension or flexion with the maximum power and not be overextended or not having those bridges or flex too much.
Okay, so basically what we're saying, as I understand it, is that if you're at the extreme ranges, you have to move to the midpoint for the muscles to start actually working effectively.
Yep. And then you could be potentially in the endurance side of things wasting calcium stores. So it's a whole other metabolic system there.
Okay, so basically, as this is great because I've not heard a good explanation until now as to why it makes sense, the muscular, how the muscles work, why that makes sense. We know that the joint angles to keep the joint safe in safe ranges, but like you said, there's also an implication on force you're applying and make it more effective for the muscle to fire. And you're going to be producing, like you said, it's if you go all the way down and try to touch your butt to the ground and with a heavy weight on the squat, very difficult to stand back up again, versus if you're doing a quarter squat, it's very easy to do 10 reps where you can maybe do one with the other one. So it's all about where the muscles are firing and the efficient force and flexion that you have as well. So Kyle, thanks for that explanation. Any other thoughts for other PTs that might be looking into getting into bike fitting?
Yeah. So I think in general for bike fitting, there are very mild, let's say mild courses. They're not very educational that are out there, like on continuing education sites. I think with this course in particular, kind of as PT does things, it's looking at the full body, all the mechanics, and it's looking at how the bike can be changed to fit the person, maximize their power output, maximize their comfort. I think that's where the benefit of this course is the experience and the information that is provided.
Well, great. Any parting words?
That is all.
You're starting to do fits now,
Yeah.
and you're so as the students get out into the field and they start doing fits, I would consider you having when they graduate the course, I consider them having the equivalent of an intermediate level fitter understanding of knowledge. And now it's just going to take that and apply it. And the other thing that we stress is a process. You do one thing first, you do the next thing. When that's finished, you do the next thing. So you'll never get lost. You can always go back one step, and it's just a step-by-step process, and apply that to the clients. And I think you're going to be a success. So thank you, Kyle. And
Thank you.
we'll talk to you shortly again. Take
Sounds
care.
good.